Welcome back to Afternoon Express, and of course today's Wednesday show is dedicated to learning more about the coronavirus. Now, before the break we learned some of the important facts about the new coronavirus, and of course we are now joined by family practitioner Dr. Layla Bhikoo, who is here to share some practical advice on how to keep ourselves and our families safe. And of course, if you would like to add to the conversation, then please make sure you head over to our social media platforms, send us a question and use your hashtag Afternoon Express. Welcome to the show.
Hi, thank you.
So we learned before the break that we are not entirely certain of the efficacy of those masks that people are traveling with. Because I suppose that makes a lot of sense. If you are sitting on a plane, you remove it to eat or something, you've put your hands on it and it's just going to be contaminated as much as anything else.
Yeah, I think it gives people a false sense of security,
Yeah.
especially if you're not wearing the mask properly, or it's an ill-fitting mask, or you're taking it off, as you said, putting it back on. You're touching other surfaces in between, and people aren't going to be as careful with their hand washing. So they might remove the mask, eat something, touch a surface, and then unknowingly touch their face before putting the mask on again. So, I mean, yeah, I mean, it works as a very good preventative or mechanical sort of prevention in you spreading it.
Yeah.
But with regards to contracting it, it might not be as effective.
Yeah. Let's go to, if you are, found that you do have coronavirus, what actually plays out in your body when you have it?
So it's basically similar to your flu-like symptoms. So it's a respiratory it's a respiratory disease. So it's going to affect you the same way your flu-like illnesses are, and your other coronaviruses are going to affect you. So you're going to get your cough, you're going to get the flu-like symptoms where your muscles ache. You can get shortness of breath or difficulty breathing. You're going to feel tired. And then it can play out to the more severe forms. And the more severe forms are things like your severe pneumonias, your acute respiratory distress syndromes, sepsis and septic shock. And those can also obviously then lead to death. And I think that is sort of the sequelae of the more severe forms of it. Okay. But I don't think people should focus too much on that. I think there's so much hysteria about the severe forms, but everybody's sort of forgetting just the common flu-like symptoms that you are going to experience in the beginning.
Exactly. You know, I think with the traveling, even if you don't get coronavirus, I think just if you have to be, separated from your family, if you have been on a plane with people that do, I mean, it can really, really disrupt your life.
Exactly.
And there isn't a known cure yet?
No, so there's no vaccines available, and a lot of people are asking, especially in GP practice, if I get the influenza vaccine, which is available sort of towards the end of March, am I going to be protected? And it's a common myth amongst a lot of people. They're saying, okay, so I'm going to get the influenza vaccine now, or I'm going to take an antibiotic. Is it going to protect me? That is not. So the influenza vaccine is specific for the influenza that's common this time of the year. Your antibiotic obviously will only work on your bacterial infections, not your viral infections. But what I am telling my patients, especially at the practice now, because you have so many people coming in with these questions, is do get your influenza vaccine. It's not going to prevent you from getting the coronavirus, but it is going to alleviate the confusion of, do I have corona or do I have influenza? And also it decreases the burden on healthcare if you do get your influenza vaccines. And we know that you don't have, influenza.
Yeah. How are people tested for corona versus influenza?
So it is basically the same. You'll do the nasopharyngeal aspirate. So you'll go to your healthcare professional or you'll go to your nearest lab and they'll take swabs, and then obviously they'll do something called a PCR on those, and they'll detect which viruses you have.
Okay. So today I read that if you do have coronavirus, or if you think you do, you shouldn't go to your doctor.
No, exactly.
What should you be doing instead?
So the reasoning behind not going to your doctor is, if you are going to sit in your doctor's consultation rooms, you are going to expose firstly your doctor, and then also all the patients in the rooms. If you expose your doctor, if we test positive, we have to, or if we are in contact, we have to be out of our practice for 2 weeks.
Totally.
Which can completely, it affects the whole healthcare system. So the best thing to do is, if you feel that you are a positive contact for the coronavirus, is to actually contact the NICD. They have the contact details online, or just phone your nearest doctor and ask them, what exactly do I do?
Yeah.
So rather pick up the telephone. They will definitely be able to give you advice, or the NICD hotline.
We have that number on our screens right now. So if you do think that you have the coronavirus, please do give them a call. And then what will they do? Will they send somebody with a test for you?
So no, they will sort of facilitate that the testing gets done.
Okay.
So they will either send you to the nearest lab, or they will get in contact with a healthcare professional that is able to do the testing, so that healthcare professional also takes the necessary precautions and also gives you a mask to wear so that you're not, infecting any other people also.
Okay.
While doing so.
Okay. And then what happens from there if you do have coronavirus? I think at the moment what's happening with a lot of people is that they're being quarantined at home.
So yeah, it depends on obviously the severity of it. So there are, some of the patients have been self-isolated. And then obviously there are certain facilities where, so be it state or private facilities, where the patients are going to be quarantined until the infectious state is over. So at the moment, the research is showing, or it's actually just presumed, that the infectious state is as long as you are symptomatic. So we are waiting till patients are asymptomatic, and then they are free.
Good to know. I've learned a lot today already. Thank you very much. All right, let's cross over and see what you at home want to know.
We've asked you on our socials if you have anything to add to the conversation, and we have Avosa, who said, I overheard that the virus can be passed through the air that we breathe, and if that is true, what precautions do we need to take to stay safe at all times? Most symptoms that can guarantee, what symptoms, I guess, can we guarantee that you can identify if the person has the coronavirus?
Okay, so at the moment, according to the National Institute for Communicable Diseases, the guidelines are that it is not an airborne disease. It is more a droplet spread. So say now somebody sneezes, touches something, and then you touch it and put it basically on your mucosal membranes with your eyes, your nose, your mouth. That is how it spreads. So it's not if I breathe next to you necessarily that you're going to get it. Okay, so it's more by droplet spread, not by airborne spread. And then the symptoms that patients can expect if they do believe that they have coronavirus is, like I said before, the flu-like symptoms. So your cough, your fever, body aches and pains, tiredness. So those are your common sort of symptoms. And like I said, they are common to a whole host of respiratory conditions.
But droplet spread can drop quickly. Like, I remember a story with my makeup artist, and she was chatting to this guy who was a chronic spitter. And what happened was he spat while he was speaking, and it landed in her mouth.
So
she panicked. She sprayed her mouth with alcohol. It was hilarious. But no, it's
so droplet spread, exactly, and that's why we say, so especially if you're traveling on an airline, if, say, one of the persons tested positive, they would look in a 2-meter sort of radius around you, and those would be also deemed positive contacts. So 2 rows either way.
That spreads, All right, what's our next comment?
Who asked, hi, since they say that the virus is accurate or accelerated in surface and hot temperature, I think she's trying to say that if you're in contact with hot surfaces, what should you do and what tips do you require for us to get infected?
Yeah, does it prefer any temperature?
There hasn't been any evidence to stating whether it prefers certain temperatures. I'm sure that, those things will all come to light as the disease evolves and we get a bit more information. It's still quite early days. I mean, it's only been around for a few months now, so we're still gathering data to see what exactly the conditions are.
Thank you very much for being here. We've learned a whole lot more, and we've still got more to come when it comes to COVID.
Absolutely, Jeannie. Now, after the break, we take a global look at the coronavirus. Should we be avoiding international travel? And what about our pets and the food that we eat? Can they be contaminated too? Well, if you have any questions of your own to add to this, just head over to our social media platforms and make sure to use the hashtag #AfternoonExpress.